Okay, good morning everyone, and welcome back at this bright and early time to start the second and final day of our workshop on strategies to limit sugar-sweetened beverage consumption among young children, evaluation of federal, state, local policies and programs. Again, my name is Karen Cullen, and I had the great pleasure of serving as chair of the Workshop Planning Committee. So yesterday we had a very full agenda and a host of incredibly informative presentations and fantastic discussions with our speakers and with you in the audience. Our presenters covered a range of topics, including current sugar-sweetened beverage consumption among young children, existing guidelines, and policies that affect federal nutrition programs, state-level policies, and childcare settings, along with other emerging and innovative strategies taken at the county and local levels to limit sugar-sweetened beverage consumption in young children. So for this morning, we have two great sessions planned. The first will explore the role of industry in sugar-sweetened beverage consumption. And then the final session will reflect on the key messages that we heard during the course of this workshop, and will conclude with a panel discussion on what evidence gaps exist and therefore what future opportunities there are concerning this issue and to fill those gaps. Like yesterday, we want to continue with our great, robust, facilitated discussion. Those attending in person here received the white index cards for you to write down your questions, which we'll collect at the end of each presentation. And then those of you joining us online, please continue to use the online platform to submit your questions. And then our moderators will use those to guide the discussion portion of each session. Again, keep your questions concise so we can get through as many as possible in the short few hours we have left. So, as I mentioned yesterday, PDFs of the presentations and the video recordings will be posted on the webpage by next week. And then in the months ahead, there'll be detailed proceedings published of all that takes place during this workshop, and a short in-brief version will also be prepared, and those will also be available on the National Academies webpage by the end of 2017. With that, I'd like to begin day 2 of our program on session 5, the role of industry, and Barb Devaney is the moderator for this session. Thank you.
Good morning, everyone. My name is Barbara Devaney, and I'm a senior fellow at Mathematica Policy Research, and I'm going to be moderating the session this morning. The objectives of this session are to consider the role of industry in the current consumption patterns of sugar-sweetened beverages in the United States, particularly young children, and more specifically to explore strategies that industry can take to improve children's health by reducing sugar-sweetened beverage consumption through approaches such as marketing, partnerships, product reformulation, and any other kinds of strategies that might come up during our discussion. It's my pleasure to introduce our 3 speakers. First, we will have Jennifer Harris from the Rudd Center for Food Policy and Obesity to discuss marketing to young children and their parents. Then we will have Richard Black of Quadrant D Consulting, who's going to talk about voluntary and regulatory approaches of industry. And then finally, we'll have Anne Faree of the Alliance for a Healthier Generation to talk about partnerships for improving beverage choices of young children. And as just mentioned, I want to remind everybody again, if you have questions after each of the presentations, please pass your index card to the center and we'll pick them up. And for those of you on the web, please submit your questions before the end of the session and before the facilitated discussion. And with that, I'd like to welcome Dr. Jennifer Harris of the Rudd Center for Food Policy and Obesity.
Good morning, everyone. It's great to be here. I'm going to be talking about marketing sugary drinks to young children, but also their parents, who we know are the prime decision makers in what they're consuming. And I'll start with some definitions. First, what is a sugary drink? We basically discuss any beverage that contains added sugars. So a lot of the products that we were talking about yesterday, soda, fruit-flavored drinks, etc., those are definitely sugary drinks. But I'm also going to be talking about sweetened milks and supplements that are designed specifically for very young children. I was also asked to define marketing, so I went to the source, the American Marketing Association. And as you can see, it's a very broad definition. Anything that influences people's purchases, attitudes, opinions. But more practically, we like to think about marketing in terms of the 4 Ps: product, price, promotion, and place. And when people talk about marketing, a lot of times they refer to advertising, which I think it's important to understand this is specifically persuasive messages placed in mass media, so TV, radio, internet, print. But marketing is much broader than that. Marketing includes product formulation, packaging, claims, promotions, licensed characters, shelf placements, point of sale displays, and that's just what I'm going to be talking about today. There's a lot more. And finally, I want to define brand, which is the customer experience represented by a collection of images and ideas. And that sounds very vague, but basically the thing to remember is that most packaged goods companies have a brand manager whose responsibility is to maximize profits across all products underneath a single brand. So it's a very broad umbrella. And final piece of background is how does marketing affect kids? And I'm sure this audience is very familiar with the IOM report that came out in 2005, which concluded that marketing affects children's brand recall, preferences, requests to parents, and short-term consumption of advertised products. And these findings are based on all of the literature that had been done up to this point, and they're not very surprising because that's why companies are spending the money to market to kids. But the report also said that the evidence was inconclusive on how marketing actually influences diet and BMI. And I think it's important to understand that it's inconclusive because the research had not there hadn't been a lot of research done on that topic at that time, not because the studies that were done weren't conclusive. So a lot of researchers, including us at the Red Center, have been trying to fill that gap in research in the past 10 years. And the evidence is growing quickly that food advertising does impact kids' unhealthy diets in many ways. It increases preferences for categories, so not just Pepsi versus Coke, but for soda overall. And interestingly, advertising for diet soda influences consumption of regular soda as well. It influences calories consumed, so when someone sees a TV ad for food, they'll consume more of whatever is in front of them. This happens with adults as well. It affects evaluations, how much you like the taste of a product. If somebody sees an ad that they like before they try the product for the first time, then they're actually going to like the taste of that product more. And this is why it's really important for marketers to get to kids before they've tried their product and sort of frame the experience. It has normalization effects, making these products seem appropriate and common to feed children, and also affects parents' attitudes. So now I'm going to talk about marketing of sugary drinks in a few areas. I'm going to talk about what products are marketed for children, how companies are marketing to children under 6, and how they're marketing to their parents. We've done a couple of very extensive reports on sugary drink marketing, and in 2014, what we found is that basically the drinks that are marketed as intended for children, so this is based on the ads on the internet, the sugary drinks are basically mostly fruit drinks and a few flavored waters. And then if you look at the nutrition, so these products had over 800 million in sales in 2013, which is 34% of sales for their specific categories. So 34% of fruit drink sales are children's fruit drinks. When we look at the nutrition, I have the data here for 2011 and 2014, but not much changed during that time. There were 9 brands in 2011, 8 brands in 2014. I should say these are brands that spent more than $1 million in advertising in the year. Over 90 products. The median calories was 60, median sugar grams 16, although going up to 33. The only big change was the incidence of juice. So 40% of these products also have non-nutritive sweeteners, so things like stevia or sucralose. And I think this is important because when we talk to parents, they say they don't want to give their child these products. So a lot of times they're in the nutrition facts panel, and we have nutritionists working for us, so they know what they are, but I don't think most parents do. The percent of products containing some juice went up, but they still only contained 5% those products that had juice, and a maximum of 11%. So another thing to understand about marketing to young children is that the psychology studies have been going on since the 1970s, have concluded that children under the age of 7 or 8 do not have the cognitive capacity to understand the persuasive intent of advertising. So they see advertising as just any other source of information about these products, same as their parents or their teachers or their friends. And because of that, lawyers have looked at this issue, and we talked about the First Amendment yesterday, and a few papers have concluded that any advertising to children under 8 is inherently misleading, and so should not be protected by the First Amendment. So that's one area to think about. So how do companies market to kids? Well, I showed you a whole bunch of packages in a previous slide. Bright colors, animation, fun fonts, brands. Those are all ways to attract kids' attention in the supermarket when they're there with their parents. Companies also do games online. These are just some examples from our 2014 report. Brand characters are a big way to market to young children, and young children recognize these as young as 2, as well as licensed characters. So now I'm going to switch from marketing to advertising. And the Children's Food and Beverage Advertising Initiative was established in 2007. Most of the major food companies participate in this program, and they set nutrition standards for products that can be advertised to children. And in addition, the majority of participants, I think McDonald's is the only one that doesn't, have a policy that they will not engage in advertising primarily directed to children under 6. So the industry recognizes that children under 6 should be afforded extra protections from advertising. So what does that mean in practice? Well, we pulled 2016 data from Nielsen on what advertising was appearing on television, and also how many kids were seeing the ads. What we found is that on children's television, there were only 3 products that were being advertised, there were only 3 children's products being advertised on TV in 2016. The most advertised product was Capri Sun Organic, and this is an interesting product. It's not 100% juice. The first ingredient is water, but it does not contain any added sugar, just juice concentrates. So this is definitely not wouldn't count as a sugary drink. Then there are 2 other drinks that both from Kraft, Capri Sun Roaring Waters and Kool-Aid. These products are similar. Their ingredients are water and sugar, and Capri Sun has stevia sweetener, and Kool-Aid has sucralose in it. So these are the only products that are children's products that are currently being advertised on TV. So how many kids are seeing them? Oh, and I should say, this is a result, I think the CFBAI can take credit for this, that there are no more full-calorie sugary drinks being advertised when they implemented new nutrition standards in 2013 that reduced the sugar and the sugar content of drinks that can be advertised to children. So this is how many ads children are seeing, and I picked 4 years, 2007 through 2016, on TV, and so these are the number of ads per year on average that a 2 to 5 year old child will see. And Capri Sun brand is the drink that's advertised the most to children 2 to 5. Important to note that in 2016 it was mostly that juice drink with water and juice concentrate versus 2010 and 2010 when it was mostly the regular Capri Sun fruit drink. Another thing, the two other fruit drinks are Sunny D and Kool-Aid that have been advertised traditionally. An interesting thing to note here is that Sunny D was not advertised on TV in 2016. Now, they're not a CFBAI participant, so I'm not sure why. It may just be a one-year thing, but I think that's good news. This is a complicated slide, but the point is how many of these ads were seen on children's TV. And if you look at the 2006 numbers, almost all of the ads for these products that young children saw were on children's TV. So that's the kind of television that is covered by the CFBAI. And this differs. In previous years, the numbers were lower, and this was because companies were also advertising these products to parents, to adults. Now, if you recall, I said that the CFBAI companies say they have a policy to not direct advertising to children under 6. So the left is the 2 to 5 year olds, what they're seeing, and the right is 6 to 11 year olds, what they're seeing. And the point to take on this is that 2 to 5 year olds are seeing somewhat less, about 37% less in 2016, but 2 to 5 year olds are watching the same programs as 6 to 11 year olds in slightly smaller numbers. So to say that they're not advertising to young children is not it's not inaccurate the way they define it, but it leaves the impression that young children are protected more than they really are. Then there's other products that aren't targeted to children. And we saw a big jump from 2015 to 2016 in the number of soda ads that children are seeing. Now, there wasn't a big difference for adolescents and adults, and we're not sure what is the reason for the children's greater exposure. We have to go back and look at the numbers more closely and where they're advertising. They're not on children's TV. But as you can see on the right-hand side, Pepsi and Coke almost doubled their advertising to children 2 to 5 from 2013 to 2016. Another point on this is that I don't have the numbers here, but Black children watch a lot more television than white children, so they are exposed on average to about 60% more advertising for food than white children are, including 2 to 5 year olds. The other thing to note is that the soda companies are targeting Black audiences with their advertising, and so these differences are even bigger for products like soda. It's about double the number of ads that Black children versus white children are seeing. So now I'm going to switch gears a little bit and talk about marketing to parents. And I think this is a really important topic because, it's easy to blame the parents. They're, the ones purchasing the products, they should know better. But the strategy for children's products is really two-pronged. It's advertise to the kids to get them to ask their parents for the product, and then market to the parents to give them permission to purchase the product for their child. And the way they give them permission is by nutrition claims. So these products, sugary drinks, have on average 4.3 nutrition claims per package, things like good source of vitamin E, pictures of fruit on the package, more good stuff, no bad stuff. Of course, that one also has, it says no high fructose corn syrup, but it does have sugar. Sunny D, I think, is a brilliant marketing strategy. If you look at the product, it looks like orange juice. It's often stocked in the refrigerated section of the grocery store next to the orange juice, but it's a shelf-stable product. It doesn't have to be stored there. It has pictures of fruit on the package, and it has more sugar as well as high levels of sodium and artificial sweeteners. It's probably the worst product to give your child. And then we talked yesterday a little bit about the confusion between the different kinds of groups, and this picture comes from the Capri Sun website, and I won't go into the chart below, but basically their portfolio includes flavored waters, the juice drinks, which are water with fruit juice, fruit drinks. The middle one is their traditional Capri Sun, 100% juice, and now a sports drink. So they now have a sports drink. Some of these are approved by CFBI, some are not. Some are advertised, some are not. So I think this picture speaks for itself. So are sugary drinks healthy? We did a study with over 1,100 parents and asked them their opinion, whether they served different products to their children and what they thought, how healthy they thought they were. And this, I think, matches with the data from yesterday. 92% of parents with 2 to 5-year-olds served their child some form of sugary drink in the past month, on average 2.4 different types. The numbers down there, the percent of parents that provided the products. So 80% gave their child fruit drinks, about a third flavored waters, sports drinks, and 40% soda. Now the red bar is, so then this graph shows how healthy they think these products are. And the red bar is the parents who gave the products to their child. The blue bar is the parents who didn't. And so clearly the parents who gave the products to their child thought these products were healthier, or were more likely to think these products are healthy than parents who did not. And interesting, when we looked at what they thought of individual brands, so just for example, these are the bars for vitamin water versus flavored water to the left. So parents are more likely to think that vitamin water is healthy than flavored water. Same thing for fruit drinks. They're more likely to think Sunny D and Capri Sun are healthy than when you ask them, are fruit drinks healthy? And Gatorade are healthier than sports drinks. Now, this isn't surprising either, because the point of marketing is to differentiate your brand from every other brand. So companies clearly have been able to do that and show that their products are better than their competitors. But when you ask somebody in general, they're not gonna think about that specific product. We did a study looking at sales data on children's drinks and how much of sales were due to promotions. So in this analysis, we looked at whether it was a children's drink or not, whether it was a national advertiser or not, and then the nutrition of the products. So if they had added sugar, non-nutritive sweeteners, or no sweeteners, which would in most cases be 100% juice. We only looked at single serving containers because that's what most of the children's products come in. In terms of the number of UPCs, 71% of children's products had added sugar versus 46% of other types of products. When we looked at how much of the sales were due to the different kinds of promotions in the supermarket, children's drinks with added sugar that were much more likely to be affected by pricing reductions. So that's the percent of unit sales that occurred when there were price reductions going on. More than adult products and more than children's products without sweeteners. A similar finding were displays. So the things like the end caps and special displays in supermarkets also had a greater effect on whether parents bought children's products with added sugar. My last few minutes, I'm going to now turn to toddler drinks. This is a fairly new category. There actually isn't even a proper term for them. They're toddler milks, toddler drinks, toddler formulas. Different people call them different things. These are basically, and I've included Pediasure here because their marketing is very similar to the toddler drink company marketing. They're really intended to serve children after they've been, after they're off formula. And the American Academy of Family Physicians says there's no reason to serve these products to children. And if you look, they're all about growing. So Pediasure, says your child is behind the growth curve, start 2 a day. So, just anecdotally, WIC counselors have told us this is one of the most requested exceptions to the WIC package that they see, that a lot of parents want prescriptions for Pediasure. So what's in these products, this is Infigrow. You can see it's milk and sugar, and then lots of other ingredients. And these products have a lot of structure function claims on them, so claims where ingredients actually benefits the child's health. All the packages have them, and they average 2.3 per package. Now, this is an area that the FDA has expressed concern about on infant formulas, but it's just as prevalent on these toddler formulas. And then they're spending a lot. So this is the infant formula versus the toddler drink spending from 2011 to 2015. It's up 74% down, but down for infant formula. So it's a lot of the same companies, they're switching their spending to these drinks. And then these products are advertised extensively on Spanish language advertising. In fact, when we looked at all of baby and toddler foods and drinks last year, these were the only products in those categories that were advertised on Spanish language TV. And when you look at how much they're spending as a proportion of their total advertising spending, it's very high. So 100% for Nido, which makes sense, that's a Hispanic targeted product, but 25% is the highest we've seen of any product category, of any brand in any other product category. So they're really focusing on the Hispanic market. And if anyone can read Spanish, this one shows how Nido 1 Plus is better than milk. So conclusions. I think the good news is that there are no more full sugar drink ads on children's television in 2016. So I say that is an accomplishment. And even it's not even 100% juice. So we talked a lot about that yesterday. I mean, I think at least the I don't want to say watered down juice, but the water and juice products are less calories and less sugar than full juice. But on the other hand, CFBI does not protect children under 6. They're seeing almost as many ads on children's television as older children do, and they're also seeing a lot of ads that aren't on children's television. I think this marketing really is confusing to parents, and I think we talked about that a little bit yesterday, but I'm sure they don't understand the ingredients and the nutrition that are in a lot of the products, and they think they're healthy when they buy them for their children. And also the branding is another area of confusion. And just like to highlight this emerging issue of sugar-sweetened toddler drinks. These drinks didn't exist 5 years ago. They're sweet, basically sweetened milk, and we're talking about a life course progression. That is probably not something that you want to be giving your young child. And my time's up, and that's it. Thank you.